Hi, this is the section about our surgeons, the hospitals and staff. So I thought I'd just pop on and just have a quick chat with you about what we can offer. We have two surgeons that work with New Leaf. The first one that we've worked with for most of the 7 years or 8 years that we've been around is Dr. Martin Ruby. He is the president of the Bariatric and Metabolic Society in the Czech Republic, so he's a really renowned and respected surgeon in his field. He's done thousands of gastric sleeve bypass and complication surgeries. He also does mini gastric bypass, and he has recently started doing the new SASI bypass. I think he's one of the first in Europe to actually provide this for patients. It's such a promising new surgery that we think is going to be really big in the future. He works from a hospital called Bariatric Hospital in a little town called Turnov, which is about an hour away from Prague. And this hospital is a state hospital. It's not a fancy boutique clinic hospital, but it's a state hospital, which means, this was really important for me, it has an intensive care unit on site, right next door to the theatre and the wards. It has got every other possible specialist you'd need just in case anything should go wrong. And you stay in the hospital, are monitored by nurses, experienced nurses, the whole of the time that you are there. You're not rushed out to a hotel. You stay there and you're monitored for 5 days, so that when you go home, you can be confident that you're fully rested and that as much as possible, any complications have been picked up before you leave. We also have Dr. Michal Cieni. He is also an exceptionally qualified and very well-known surgeon in the Czech Republic, and he works from a hospital in Breslav, the south of the Czech Republic, very close to the Viennese and the Bratislava border. He's also been around for a very long time, lots of experience, and he is a specialist in the mini gastric bypass and was trained by Dr. Rutledge himself, who was the inventor of that procedure. Again, very, very good hospital, state registered hospital with intensive care unit inside, all of the nurses, and again you stay for a period of 5 days after your surgery so that you are fully rested before you return home. In both hospitals, some of the nurses speak English, some of them don't. We can't possibly guarantee that in a state hospital that all nurses at all times will speak English, but most people can get by using Google Translate, and the nurses do their very best to get to understand you. But usually there's at least one nurse on the ward at a time that speaks English. All of the doctors speak fluent English as well. So these hospitals need doctors have got really low complication rates, and that's something that you really should be looking at when you're looking for a surgeon. International average for a leak after a gastric sleeve or bypass is 4.5%. That means 4.5 people out of 100 on average would have a leak. This is the thing that we really don't want, because it can be life-threatening, and if nothing else, you would spend several weeks in hospital on nil by mouth and not having a great time. Now, I'm not saying this to scare you, but at New Leaf you will know we have complete transparency. I never hide anything from my patients, and therefore you need to be aware that these complications happen. With Dr. Cieni and Dr. Ruby, the leak rate is less than 1%. So against an international average of 4.5%, their leak rates are very low because they are extremely competent and experienced surgeons. So you can be sure that you're in good hands. We also don't accept everybody. We only accept people that we really believe will benefit from this surgery. So we make sure that your health is going to be better after the surgery than before the surgery. That's our most important thing, is your health and well-being. That has to be at the foremost of our minds when we are choosing patients for this surgery. Have a look at the CVs of Dr. Ruby and Dr. Cieni and see their qualifications. Also, on our Bariatric University page, you will find videos of both of them talking about their procedures. You can get to see them and their personalities, talking to patients on there. So have a route around. You've got loads to look at. Any questions, let me know.